good at responding to concerns when they're raised. But if for some reason a patient or a relative feels that actually they've brought this up a couple of times and it's not been resolved to their satisfaction, they can go to a Purple Point, pick up the phone, using either English or one of the 5 community languages, get through to our team. And what the team will do then is take the concern, they will then make sure that it's given to the right person to respond to it then and there. Now, it doesn't mean to say we'll resolve it. Would be if, say, for example, one of your parents was in hospital and you wanted to talk to the consultant looking after them, but it was a Friday and the consultant wasn't there. We could offer for you to speak to an on-call person, or we could offer to make an arrangement for a meeting the following week. But the important thing here is that we would converse with you immediately and make sure you know that that's happening. But importantly, we won't do that without the patient's consent, because of course the patient is the person who gives us permission to talk to you as relatives, etc. These are outside our inpatient areas because they are really designed more for our inpatients, not our outpatients, because they have ways of doing it through PALS, etc. Most of that is Monday to Friday 9 to 5, but this allows us to do it outside of normal working hours. Thinking about how best to get that feedback and make sure that we've got some satisfaction out of it, because of course we can do this, but we want to make sure that whoever's using it has got the outcome that they wanted in the timeliness that we're planning. So that's the plan. So we've got the Purple Point just because it stands out, etc. We will be putting them in Midland Met. We've already planned for that. So for the moment they're here.
Pakistani and Bangladeshi community is one of the most underrepresented groups when it comes to complaining about services. What nobody should feel is that if they complain about a service here at this trust, that their care will be hindered. No one should feel that. So people should be using this without any fear that the care offered to them or their loved ones will be jeopardized in any way. We've got it written in Urdu, so if you don't speak English, you can't read English. If you can read Urdu, you read that and you dial the number. The same with Bengali here as well. That says Bengali and Bengali. I'm right, aren't I, Cheryl? Yeah. And you dial 8185. And the same applies for Romanian, Polish and Punjabi too. And somebody will, on the other end of the line, pick up the phone and speak to you in the language that you want to speak to them in. So usually that.
अगर आप किसी मसले के बारे में बातचीत करना चाहते हैं या किसी स्टाफ मेंबर के बारे में अच्छी राय देना चाहते हैं तो बराए मेहरबानी लाइन को होल्ड रखें। हम आपका किसी इंटरप्रेटर या एडवाइजर से राब्ता करवाते हैं जो आपसे बात करेगा। आपकी कॉल क्वालिटी और ट्रेनिंग के लिए रिकॉर्ड की जाएगी।
We're really enthused to introduce our Purple Points, which are outside our inpatient wards at all of our hospitals. The idea behind them is to enhance the way that we allow our patients and their relatives to bring concerns to us, but it also allows them to complement staff or the care that they've received. We've initiated these in the 5 top community languages as well as English, so if you can't speak English, there is an opportunity through an interpreter to actually get your concerns over. This isn't to replace anything we've already got in place, but it does enhance what we've already got, which is obviously phone writing and also bringing your concerns to the staff who are caring for you at the time. So this is just another way of making sure that our patients get a good experience at our hospitals by getting their concerns resolved at the time that they're in and not having to wait till they go home.
सैंडल वेस्ट बर्मिंघम NHS ट्रस्ट में कि जो हमारे पेशेंट्स यहाँ होते हैं और पेशेंट्स की फैमिली होती हैं, उनको कोई कंप्लेंट हो या कोई सर्विस में राज़ी ना हो, वो यहाँ आके इस टेलीफोन को इस्तेमाल करें, उर्दू में बात करें, पंजाबी में बात करें, इंग्लिश में बात करें, जो भी ज़बान वो कंफर्टेबल जिसमें फ़ील करते हैं उसमें हमारे साथ रब्ता कर सकते हैं। मैनेजमेंट फ़ोन उठाएगी, वो जो मसला मसाइल है उसमें हमें आगाह करें ताकि हम बेहतर से बेहतर यहाँ सहूलत प्रोवाइड कर सकें। हमारी ये ट्रस्ट जो है ये पूरी इंग्लैंड में बल्कि पूरे UK में ये पहली ट्रस्ट है जो मुख्तलिफ लैंग्वेजेस में ये कंप्लेंट सिस्टम और ये टेलीफोन सिस्टम, ये जो हमने सहूलत प्रोवाइड की है ये यहाँ सैंडल वेस्ट बर्मिंघम NHS हॉस्पिटल, जो हमारे जो 3 अस्पताल हैं, सैंडल हॉस्पिटल, सिटी हॉस्पिटल बर्मिंघम और रॉली रिजिस हॉस्पिटल जो सैंडल में आता है, ये तीनों हॉस्पिटल में ये सहूलत प्रोवाइड की जा रही है और 9 AM और 9 PM मंडे टू संडे ये सहूलत प्रोवाइड की जाएगी। हम दूसरे अदारों से भी राब्ते में हैं कि इससे कितनी बेहतरी आती है हमारी सर्विस में, और हमारी इंशाल्लाह ये कोशिश होगी कि यहाँ बेहतरी आई तो दूसरों में भी उनको भी ये हम एडवाइस करें कि वो भी ऐसी कंप्लेंट्स जो सिस्टम है वो भी प्रोवाइड करें।